Hello, my name is Vicki Turner and I'm in Nursing 205 and I'm going to be showing how to hang a piggyback for IV therapy. My patient is Mr. Shepard. He is a 72-year-old male. He has COPD. He has been moved to the med-surg floor. He has a chronic tracheostomy, lives with his family and gets assistance from them. So the physician ordered Rocephin 1 gram IV daily. The volume runs at 100 mils to be administered over 30 minutes with a drop factor for tubing of 10. So first you need to figure out what your GTTs per minute are. So once you take that 30 minutes and divide it into that 100 and multiply it by that 10, you're going to get 33.3 GTs per minute, which is going to be 33 GTTs a minute that your IV pump should be set on. So the first thing we do is we're going to gather our equipment. Our equipment, in other words, is our secondary tubing, our medication, our antimicrobial swab or alcohol swab. Some hospitals have these that have the alcohol in them already that you can put on the end of the IV, or you can also put it on the person's IV. You want to make sure the patient has D5W, yes, correct, D5 and a half normal saline running at 100 mils an hour. They already have this running already. So you want to make sure that your Rocephin is compatible with this. Now, in some hospitals or long-term care facilities, they have, well, it should be in all, forgive me. In all hospitals and long-term care facilities, they have resources for that. They either have drug books or they have on the computer, they'll have a certain app that you could look at. If you cannot find that, or if they do not have that, you can always call the pharmacist. They will let you know if the drug is compatible. Then what you want to do is you want to check your orders. You want to make sure you have the right patient. You want to make sure that you have the right medication. You already know how much you're going to run, what your rate is going to be already. But you want to make sure that you're checking your orders. Make sure it's exactly what the physician ordered. Next, when you enter the patient's room, once you get all of your materials and you enter the patient's room, you want to introduce yourself. That's the first thing. You don't walk into a room without letting them know who you are. So I would walk in, I would say, my name is Vicki. I'm your nurse today, if they haven't met me yet. I'm your nurse today, and you let them know what you're going to do. I'm going to hang some Rocephin, which is an antibiotic that your physician ordered for you today. You're going to be getting that daily. Once you do that, once you've introduced yourself, then you place all of your equipment on the side table. Wash your hands. Once you wash your hands, make sure you put on your gloves. We've already told the patient what we're going to do. Now we're going to check and make sure we have the right patient for the right medication. So you're going to ask that patient their name and their birthday. Once you do that, they tell you their name and your birthday. You're going to check your EMR, your EMAR, or your MAR. And you're going to make sure you check the medication. The medication generally is labeled from the pharmacy. Now, when you get this medication, in some hospitals, they have what's called a Pyxis, and that medication falls under that patient's name. Does not mean that you do not check it, because mistakes can be made. So you can do that. Sometimes they have medication drawers that are assigned to that patient. Still, if you take that out, you still have to check it. Make sure you have the right medication for the right patient. Once you do that, you're going to close the door for privacy. In other hospitals, you can scan. You'll scan the medication, you'll scan the patient's armband. When you verify that that is the correct patient by asking their name and their birthday, checking their armband, checking your MAR, and checking your medication. Like I said, in some hospitals you can scan. You would scan the medication, you would scan the armband. Once you scan the medication and the armband, they usually have it set up where the pump will automatically set the rate, but we'll go over that in a moment. So once you do that, you're going to make sure you assess the patient's IV, make sure there's no redness, no swelling, make sure that you don't see any signs of infiltration. Even though they still have this D5.5 normal saline running, they can still have problems with that IV. Make sure they're not complaining of any burning or anything. So what you're going to do with your gloves on, you're going to get your secondary tubing. On this secondary tubing, you have this little piece right here. This is what's going to go into your medication. And you're going to put that in here. So once you do that, first you're going to close off the roller. This is the roller. This is open. See how it moves? That means the fluid's going to go all the way through there. So you're going to close that off. Once you do that, you're going to take this, the sharp end of it, you're going to put it gently with just a little bit of pressure and twist so that your medication will drain through the tubing. Once you do that, you're always going to hang your medication higher than your primary. So this primary, you could either come down. Sometimes they have like a little blue hook that you can hook on there to make your primary come down. Unfortunately, I apologize, I don't have that hook. But what we're going to do is we're going to put our primary up here. If it will stay. If it won't, please forgive me. No, it won't stay. Well, we can put it there. Okay. So we have our secondary, our piggyback above our primary. Once you do that, you're going to open up your roller clamp. You're going to allow that fluid to come all the way to the end. You don't have to open it up all the way. And if you lose some, that's okay. You want to keep this fluid in here because you don't want any air bubbles to be in there, because that's very, very dangerous. You just want to make sure that your tube is clear. So then you're going to take your antimicrobial, you're going to take your alcohol swab. You're going to swab the hub on the patient. You're going to swab the hub on the primary tubing, which is going to be the one closest to the patient, and that's here. So you're going to swab this for about 30 seconds. You're going to take another alcohol swab. You're going to swab the end of your secondary. Even though you still have this clamp, you still want to be safe, so you still want to swab it. Then you're going to place the end of the Rocephin, the secondary tubing, into the hub of the primary. Push and twist. You want to make sure that it's secure. This end, of course, will be attached to the patient. Once you do that, you want to check your pump. You want to make sure that your pump is set at 33 GTTs per minute. Like I said, usually nowadays when you scan the medication and you scan the patient's ID badge, the pump will automatically do the rate. But you don't want to depend on that. You want to make sure you know what it's running at yourself, okay? So once you do that, now you want to put your labels on your tubing. Usually it's like Monday, Tuesday, Wednesday, Thursday, Friday. It's telling you when to take this down, but this is our medication, so we don't have to put that down, but we are going to make sure that our label is on the Rocephin. Once that goes, that's going to run for 30 minutes. You're going to let the patient know this is going to run for 30 minutes. I personally would stay about 5 minutes just to make sure that the patient is not having any problems with their IV. There's no burning, no itching. They're not having any kind of reaction to it, because when we go back, when we identify our patient, we're going to also ask them if they have any allergies. We're going to compare the allergies before we get in the room, and then we're going to ask the patient if they have any allergies. So now that this is running, this is going to run for about 30 minutes. You've already checked, you made sure that the IV, that everything is running fine, you see it flowing. Before you start this, I apologize, before you start this, we're going to stop our primary. So when we stop our primary, we're just going to shut off the roller on the primary. We're going to close it up and lock it. So once we lock it, we've hooked our secondary tubing on there. We've checked our pump. We're making sure that that is the correct rate. Then we're going to let this run. After it runs for 30 minutes, you're going to come back. You're going to let the patient know that it's finished. You're going to wash your hands. Going to put on gloves. What we're going to do now is we're going to close this roller on the Rocephin, on the secondary tubing. We're going to close that. We're going to take it off of the hub. Now, these clips right here, these already have alcohol in them, and some facilities have them. And you'll just put it on there, push it and turn, and it actually cleans it and keeps it clean. If you don't have this, we're going to get another alcohol swab. We're going to clean it off. Okay? Once we do that, we're going to make sure that our primary is still hooked up. We're going to switch over, because when we started this Rocephin, we switched our IV pump to secondary. All IV pumps have a secondary. So now we're going to go off of the secondary and we're going to go back to primary, which is the D5.5 normal saline. We're going to ensure that the rate and everything is still the same and nothing has changed. Once we do that, we're going to open up the roller, unclamp it, and we're going to make sure and ensure that it's still running. Same rate, same fluids. Patient is tolerating it fine. Once you do that, we're going to take down our Rocephin, our empty bag, our secondary tubing, and we're going to dispose of that. However your policy and procedure says to dispose of it. A lot of hospitals have somewhere for you to put it, because you have the patient's name, room number, and everything that's on here. If you throw it in the trash, that's a HIPAA violation. That means somebody knows what this patient is getting. You're telling their business. So we're going to discard this. We're going to take all of our materials and throw them away. Then we're going to take off our PPE. We're going to take off our gloves. Those are going to be thrown away. We're going to clean our hands, wash our hands. After that, we want to assess our patient, make sure everything is fine, see if there's anything that they want, and make sure that they're comfortable. That in itself is my demonstration for hanging a secondary tube. Thank you.